There are two extremely important organs in our human body. One is the lung, while the other is the gastrointestine. The gastrointestine is everyone's body in age with time. The aging of gastrointestinal organs is chronic suicide of a human life. We examine the gastrointestine of young people of around 25 years of age. 2/3 of their gastrointestines are aged, and only 1/3 of their gastrointestines are in a young state. You see how terrible? As we know, natural substances such as oxygen and food absorbed through the lungs and digested by the digestive tract respectively can provide energy for our body, can then be used to maintain our lives. So the first lecture focuses on the special topic of the gastrointestines. The gastrointestines has a maximum length of about 7 meters. First, let's establish a basic understanding of the gastrointestines. I know you are more concerned about the damages due to gastrointestine aging, but first we must understand the internal structure of the gastrointestines. We already discussed how long it is. Now let's discuss the structure of the gastric wall. There is the mucosal layer, submucosal layer, muscularis layer, and serosa layer from the inside to the outside of the gastric wall. The gastric mucosa, and it looks like packed stones. This is an electron microscope picture. There is a little mucus on the surface of the gastric mucosa. After drinking alcohol, the stomach will secrete mucus, which causes gastric injury. Eating chili and drinking cold water causes some damage, as drinking alcohol does. The human body has the potential to repair itself very quickly by regenerating new gastric epithelial cells. However, when the gastrointestine is aged, this function will be reduced or non-existent. What does the intestinal mucosa look like? From the inside to the outside of the intestinal walls, there are the mucosa, the submucosa, the muscularis, and the serosa. How about the intestinal glands? They are composed of absorptive cells, goblet cells, Paneth cells, and endocrine cells, with the function of secreting small intestinal fluids and mucus, etc. Intestinal villi looks like sheep wool protruding from the intestinal mucosa surface towards intestinal cavities. Well, what damages can be caused by GI aging? The first is premature aging. GI aging begins 20 years earlier than the aging of other organs, so everyone can be a victim. GI aging can result in the systematic aging of our bodies. For example, a white-collar worker at the age of 30 seems to be in his prime, but his GI may already be worse than that of an elder woman. His GI is already like that of an elder woman. Later, I will give you cases where I'm sure you will be astonished. GI aging can also lead to other systemic diseases. The next damage is metabolic disorder. Many of you here in the room may have been suffering from metabolic disorders. This judgment is reasonable because our diet is not scientific. Our GIs are not young. So, our metabolism may be distributed and this bad cycle would continue. The diseases such as hyperlemia, high cholesterol, hyperglycemia, fatty livers, and etc. can also be caused by GI dysfunction because the GI cannot digest and discharge the inappropriate things you eat through the normal metabolic process. When you are young, the GI can absorb food ingredients selectively, but when you are old, this function of your GI would disappear. That is to say, your GI cannot handle the absorption effectively, so a lot of things will accumulate in your body. Therefore, hyperlipidemia, high blood sugar, and high blood pressure will occur. Here I tell you, they won't be high anymore. After all, they are not difficult to treat. Another condition is the endocrine disorders. The GI is the largest endocrine organ of the human body. Do not mistake any secretion glands as the largest endocrine organ. Neither of them is the largest secretion gland because the GI is the real one. GI malaise affects all body organs, even your brain. For instance, if your stomach is aching, even if you want to cheer up, it is impossible. The reason is that the aching disturbs your hormone production and further influences your normal regulation of hormones. Nearly half of the people with hypertension are suffering from enterogenous hypertension. The high blood pressure in many middle-aged people is not true cardiovascular hypertension, but is caused by the cell aging of GI mucosa, which results in the reduction of inhibins both in the GI and the brain. We have made progress in research on this and found that after regenerative restoration of GI mucosa, the blood pressure can decrease. Many of our club members, guests, and volunteers are patients with enterogenous hypertension. After treatment, their blood pressure returns to the normal level, and they even have no need to take hypertensors. Diabetes, type 2 diabetes, is not directly caused by insulin, but by the endocrine system. For example, in 2001, I was diagnosed with diabetes with hyperglycemia by the 305 hospital and the 301 hospital. The fasting blood glucose level was 17, while the postprandial blood glucose was 24. I was shocked at that. Director Lee urged me to seek treatment for my disease since it was quite serious. but now it is not. My diabetes was caused by endocrine disorders, not by the pancreas. My pancreas is not damaged. Therefore, friends, when you suffer diabetes, do not take insulin blindly. Find ways to adjust and regulate your body. After all, insulin has the side effect of addiction. Intractable insomnia is definitely caused by gastrointestinal disorders. Why? The GI has a dependent nerve system to control its activities, which is contrary to the nervous control in the brain. When nerves in the brain are in the rest state, the GI will begin to work, and vice versa. But when GI disorders occur, it be in the active state where nerves in the brain are also in an active state, so things are messed up. When the gastrointestine is empty, we feel uncomfortable, but our nerves can do nothing about it, because the GI has an independent nervous system. In the future, we will touch on the nervous system again. Later on, we will continue to discuss the diseases of the GI itself. Just now, we talked about the damages caused by GI aging. What does the aged GI look like? You may have a general impression of it if you are not a professional in this field. Which is thicker, the young GI or the old one? Well, the aged GI wall is thin and the gastric glands are less dense and empty, while the restored GI wall is thick and glands are more dense and full. Gastric glands can produce not only digestive fluids, but also endocrine hormones. What does duodenum aging look like? It is similar to that of GI aging. The aged duodenum wall is thin and has very little villi, while a restored young intestinal wall is thick and has dense villi. Let's see the regenerative restoration of the small intestine. You will be surprised by our outcomes. So, you should take care of your small intestines. What does the aging small intestine look like? First, let's take a look at the aged small intestinal wall. The wall is muscle, so you can see that paralysis part, and it is so thin like a tiny crack. Look at the intestinal glands. There are only a few villi circles. Now let's take a look at what the restored young intestine looks like. The muscle is so thick, and there are many vigorous intestinal glands. So just imagine if the small intestine is regeneratively restored. No matter what kind of food we take in, its function can be vigorous, and it will be able to keep our GI in a healthy state. If not, no matter how much nutritional food we eat, our body would stay in the 1960s. It's true, we must pay attention to it. Now we look at the large intestines, which is the same as the small intestines. Firstly, this is lymph. The large intestine functions as a bacterial treatment plant in the human body. If it is damaged, who can take its place to protect our body? That is the lymph. You can clearly see the great difference beforehand and after restoration. The wall is thin and there are less glands and lymphs in aged large intestines. In contrast, in the restored one, the wall is much thicker and there are more glands and lymphs. All things are younger. This is a real successful case treated by regenerative restoration science and technology. After seeing the historical features of GI, let's take a look at visual stuff. Now what we are looking at are the pictures of the natural aged and the restored intestinal villi respectively. The villi of the aged are scarce and short, while that of the restored are dense and long. Huge difference. Intestinal mucosa villus has the function of absorption. The villi density in a young state is more than 4 million, while that in an aged state is less than 1.5 million. If this cannot also help you form a concrete concept, let's do a calculation. What are the total area of aged intestinal villi? The length of each villus is 0.6 to 1.6 millimeters, so that the total area of the aged intestinal villi is less than 50 square meters. That is to say, what we eat is digested in a sieve-like area of 50 square meters. Then what is the total area of the restored villus? It is more than 200 square meters, in which we eat is digested. On a surface area of more than 200 square meters, what we eat is digested. So we can say that once GI problems are resolved, the entire nutrition absorption will be smooth. For example, eating one egg can be 100% absorbed by the restored intestines, while only 25% absorbed by the aged intestines. So, the GI is the most important organ whose aging would severely impair the absorption of nutrients in our human body. Next, let's talk about the procedure to implement regenerative restoration and rejuvenation of gastrointestinal organs. Pay attention, guests. After my lecture, if you are interested in this topic, you can also contact us to know more details about it. I say, today's meeting is very special and is worth remembering. We will give special consideration to the attendees present. We intend to improve the gastrointestinal function. The procedure is as follows: obtaining a regenerative substance, the protecting, activating, and cultivating, regenerative restoration in situ of the gastrointestines, rejuvenation in situ of the gastrointestines, carrying out of the regenerative restoration and rejuvenation plan individually. Now, let's talk about the procedure step by step. The procedure for obtaining regenerative substances is very simple. How are the regenerative nutrients obtained? They originate from testing on the model of cloning tissue organs from gastric body cells, from an animal model. The cells from an animal stomach were taken out to be cultured directly. Remember, only stomach tissue cells were used rather than others, because others such as stem cells are meaningless here. These cells must be tissue cells, which are transformed into stem cells. Then they can be cloned new tissues, just like mucosa of human beings. In this way, we get the regenerative substances. The GI capsule, though looks like ordinary medication, you see, this is the stomach model. From the intestinal model, we need to take out intestinal cells and transform them into stem cells, so as to regenerate tissues and then to clone tissue organs. To obtain regenerative substances in this way is very easy, which is different from drug research. What we do is not to attack something using toxic substances. Our products are conceptually different from medication. To eat the regenerative substances is pretty much like eating steamed bread, fried dough sticks, and the like. This is new alimentology, and brand new nutrients are created by regenerative restoration science. Currently, there are 3 kinds of gastrointestinal regenerative substances formulae. One is a market product, which has been approved since 2001, but we didn't do large-scale marketing because we want to further our research rather than obtain benefits. Otherwise, we may have learned a lot. This kind of product is research-oriented and is for conventional use. The second is specific for individual members of our club. Based on their health data, we prepared a specific formula for different individuals. The third is specifically prepared gastrointestinal nutrients targeting specific diseases, such as that for terminal cancer patients. In these cases, the GI is generally severely damaged. In order to extend patients' lives, we have to find our unique skill. The specifically prepared GI capsule is such a product which can quickly restore the GI. After all, to save one's life is the most urgent thing to do in such cases. Above is the information about the products. Next, to talk about how to protect and activate the GI, let's see this model. It is of an oil solution with micro-wax crystals suspended inside. They can adhere to the surface of GI directly rather than float in the cavity. To protect and culture the GI cells, see, after taking the capsules, the shell is still there, but the contents has released and adhered to the surface of GI immediately. That is to say, no matter what you eat, such as pepper, alcohol, or cold water, as long as you have taken the GI capsule, your gastric mucosa can be protected from injuries. So, for the regenerative restoration of GI, we have to create such an environment. The capsule is effective 4 to 6 hours after taking it. After taking it, it can pass through the GI tract slowly. As long as you take it every 4 to 6 hours, your GI will always be under protection. GI diseases would disappear with the regenerative restoration of the GI. Let me give you another example. What does drinking alcohol do to the GI? What damages will alcohol do to GI mucosa? This is the picture of the GI after drinking 125 grams of white spirit. The GI mucosa looks like this when you feel uncomfortable after drinking. Usually, the gastric mucosa membrane can self-repair quickly. Within 3 days, it can restore to its normal state. But with the help of GI capsule, you don't have to suffer from this discomfort. After taking the capsule, the content of it can cover the mucosal membrane to avoid damages. See? The yellow content is covering the mucosal surface. So, when we suffer from motion sickness, we feel nausea, which means that our gastric mucosa has been damaged by gastric acid. At this time, it has been too late to swallow the capsule, because it cannot be digested immediately, so you'd better chew the capsule. In this way, the capsule can immediately relieve the symptoms of motion sickness and protect your mucosal membrane. The result is very fast and obvious. So, do remember to take capsules before drinking alcohol. China-Japan Friendship Hospital has conducted a study on 30 subjects drinking 125 grams of white spirit. The GI mucosa was protected in the ones who had taken a capsule before drinking, while gastrointestinal mucosa is the subjects who have not taken capsules appeared to be acutely eroded, damaged, and even bleeding. For the patients who take the medication long-term, the GI capsule is also effective to protect the GI. Patients with rheumatoid arthritis take anti-rheumatoids and non-steroidal anti-inflammatories and anglical chemical drugs long-term, which will harm their gastrointestinal tract. One comparative study has shown that there was no GI damage in the GI capsules taken group, while the GI was hurt in the group without intake of the GI capsules. Another topic that you may be anxious about, stomach cramps caused by nervousness under work stress, can also do harm to the gastric mucosa. Under work stress, oxygen consumption in the brain will increase, gastrointestinal blood flow will reduce, the mucosal ischemia will occur. All of these are inflammatory symptoms, do harm to the gastric mucosa. But if you have taken the capsule, the situation will be different. That is, the gastrointestinal mucosa will be normal and no large area of scattered red lesions in the stomach can be seen. This is the joint research outcome achieved by China, Japan Friendship Hospital and CUN Hospital. Seeing this, we know how to protect the GI and how to protect the mucosa. Leaving the topic of disease treatment behind, protecting your stomach is the most important thing. You know, this is the root of many problems. Now we can see regenerative restoration science can regenerate and restore the GI. This is a radioactive gastric ulcer that cannot be cured by any other methods, but we can cure it. Even if complicated with gastral cancerization, this disease can be regeneratively restored after 1 month's treatment. For example, this patient is a government minister who had terminal pancreatic cancer at that time. Few treatments could be thought of by doctors' panels. Then they thought of me. That was in 2002 when I just declared my regenerative science. They wanted to test out my skills in my new regenerative science, so they invited me to have a consultation. You know, the patient had given up on any medical treatment. The central government had even written a eulogy for him. What kind of situation is that? Then I said I could make his gastrointestinal mucosa regenerate. After 1 month of treatment, he was healthier than before and was able to get out of bed. His gastropy showed that the cancer and ulcers were gone. Since then, his expert panels were convinced and never dared to challenge me. Sometimes we prefer to challenge the conventional medication, but finally you can see from the results who is the winner. That is it. This is regenerative restoration. What I do is to help medicine resolve medical problems, but medicine is still medicine. Our regenerative restoration science is totally different from it being both of them can contribute to the health of human beings. One should not deny the other. Moreover, medicine has a much longer history, and regenerative restoration science can resolve the problems that cannot be resolved by medicine. For example, ulcers create a big hole. Although there are many therapeutic methods in medicine to cure ulcers, scarring will result. However, our science can cure it without scarring, and the chances of relapse is slim. Scar tissues lack the function of self-protection. Before, the gastric ulcer was classified as an intractable disease due to its scar-causing reoccurrence. But with regenerative restoration science, ulcers won't be refractory anymore. So this is what regenerative restoration science is. Then, let's move on to rejuvenation. Actually, there's no difference between the internal organs of body surface organs. Let's see the duodensin scars. Through regeneration, the duodental scars is gone, and villi grew again, in the scar area after the scars disappeared. So what other names can we call it other than rejuvenation? When villi disappears, we can make it regrow again. And this is indeed the process of rejuvenation. I believe all of you have a better idea about the concept of rejuvenation, but this just shows if there is no premature aging, there is no rejuvenation. Next, let's see the actual status of the GI system. We've observed it using the SB endoscope. The endoscope is swallowed to pass through the GI tract and radiates electronic signals which are recorded into video. In this way, we can see the changes that have taken place in the whole GI tract, such as the stomach, small intestines, etc. Let's see these pictures. You'll be astonished by what you see. Pay attention to the appearance of the GI in different age groups, and especially to the GI villi. Intestinal villi are very scarce, short and thin in the 60 to 70-year-old age group. Intestinal villi are longer, but still scarce in the 50 to 60-year-old age group. This is the 30 to 50 age group. Intestinal villi are relatively denser than that of the 50 to 60-year-old age group, while villi are much denser, longer, and thicker at 25 years of age. Without the comparison with the 25 age group, you may not realize the obvious difference between the 60 to 70 age group and the 40 years of age group in the latter is just a little longer and denser. By examining the 25 years of age group, we can see that the intestinal villi in the 25 years of age group shows the normal, healthy state of the GI. So you must be astonished by this comparison. GI systems play an extremely important role in our human body, and it is absolutely more important than our appearance. Only when your GI system is in normal and healthy state can your other organs work efficiently. Otherwise, things would be different. Today, I will show you how to restore a senile GI system into a younger status. This is the duodenum at 60 years of age. The stomach is at the age of 25. All of you can make a comparison. Look at the mucosa, which is at the younger state. This is the younger duodenum. This is the restored duodenum. So, although we cannot return to a youthful appearance, our GI can, and it can live a second life. What I have shown you today has been repeated and confirmed, and we are confident of its results. And I am sure we can help all of you achieve the same good results. Then I will show you some pairs of comparison pictures of the GI. First is a 3-month group, which shows that the GI can be regeneratively restored in 3 months, or that GI diseases can be removed and the GI can return to its normal state in 3 months. For example, after treatment of gastric ulcer, an ulcerated mucosa can be restored into normal gastric mucosa in 3 months. The changes after treatment will be shown in the following pictures. Here, the before and after photos of the stomach are difficult to differentiate. You saw bile secretion fly out from there. This is the duodenum before restoration, and this picture on the right is 3 months after beginning regenerative restoration. Let's take a look at the jejunum. We can see that the villi are denser than before, which should be the status of his age. This is already a good status if there is no rejuvenation. Several years ago I mentioned the GI regenerative restoration without involvement of rejuvenation. At that time we had not yet achieved the outcome of rejuvenation, and the results were obtained 2 years later. This is the ileum. This is the appearance before treatment, while this is the appearance after. You can make a careful comparison between them. This is regenerative restoration. Then how long will it take for rejuvenation? The answer is 1 year. Actually, in this case, it only took 11 months. This is a general case in the 1-year group. Once it has surpassed 11 months, we classify it into 1-year group. This is at about 12 months. Look, this stomach has some yellow liquid, while that one does not have. What does the yellow liquid indicate? Yes, bile reflux, which results from pleuric incompetence, so it is aged. But this does not occur in the other stomach. Now let's see a more significant comparison. Take a look at the duodenum. The difference are more obvious than that of the 3-month group. Before treatment, the villi were scarce, but after treatment, the villi are much denser. Very dense. Look at the paralysis of the duodenum before treatment. The paralysis becomes slower and slower with increasing age, but after 1 year of treatment, the GI functions were restored. The paralysis became normal and the gastric walls also became thicker. Reviewing the former pair pictures of the duodenum rejuvenation, we can see that once the organs is aging, the muscle layers will become thin. But it is opposite in the younger state. You see there is a difference in the perceval of the GI between them. Next is the jejunum. This is the senile jejunum, where the villi is extremely scarce. But on the other side, you can tell the difference. They are so dense and vigorous that you cannot find vessels easily. This is the case. Moreover, the GI paralysis is this picture is so slow. It is aged. Why do the elderly easily feel full, even if they only have eaten a little? The reason is that an aged GI makes slow paralysis. Why can young people eat a lot more and eat quickly? Their GIs have good paralysis. If we old people could have a well-functioning GI, we can also eat like young people. These are pictures show the ileum. All in all, the GI is the most important organ in the human body and should be the primary concern in healthcare. All of you tell the significant difference before and after regenerative restoration, and all the pictures taken after regenerative restoration show much younger statuses than what usually be at their age. Can we continue to have rejuvenation after 1 year? Just as I said in the beginning, it takes 2 years to achieve rejuvenation in some cases. I believe it will last longer after 2 years. That was a case in which rejuvenation was fulfilled after 3 years. Next is the 3-year rejuvenation case. The stomachs have been restored, though it is difficult to observe. We see the duodenum. This picture shows what it looked like 3 years ago. Scarce villi, thin mucosa, and obvious vessels. But after 3-year treatments, the villi are denser and the mucosa is thicker without obvious vessels being seen. This is the difference. These pictures were taken from a patient at the age of 60 years old, so he is not a young guy. The patient is a government officer with a minister title and is also the first case of successful GI regenerative restoration. So to be frank, I feel very lucky that there are some senior officers who stand behind me to support the research. Just now, Minister Shao said he was a volunteer in my club. Actually, we have many other such volunteers in my club. Sometimes they say jokingly they were my test mice, and I am very in debt to them. Without them, I may have not achieved so much. Well, look at the jejunum. This is a regenerative jejunum at age 60 years of age. There is much denser villi and much thicker mucosa. So we can say that this science is great for the welfare for human. What you see is the ileum, which is the lower part of small intestines. How amazing these results are. They are just like that of the jejunum. Well, having seen so many actual results, you must have understood what human body regenerative restoration science is. It is totally different from medicine, but it cannot replace or deny medicine. Otherwise, you are wrong. What can you do to resolve some problems that cannot be cured by modern medicine? It is to regeneratively restore all the organs of our human body. Up until now, it has only been a 3-year study. It is still a 3-year study. We have not obtained the 4th year's data yet because it hasn't been 4 years yet. But at the 5th year, we may get more exciting results. I am trying to announce my outcomes in a 5-year intervals. You have seen the relationship of GI regenerative restoration and the GI system, and now you can understand it. It is not to cure all diseases by taking one medication. So what is it? There are many intractable diseases resulting from GI aging. This is the same reason why the young do not have so many malaise, like the elderly. It is what aging brings about. But once your GI returns to a younger status again, your corresponding malaise will all disappear, and so do intractable diseases. This is a simple truth. So this plays similar roles for human health as its brother, medicine. I do not care what disease you are suffering from. What I need to do is to replace your sick cells, and then your diseases will be gone. As long as your GI is kept in a young and healthy state, diseases will stay away from you. This is its contribution and significance to human health. A well-functioning GI results in efficient nutrient absorption, which in turn results in the well-functioning of other organs of the body. It's like giving you an entire new life. This is a simple relationship. Next, I will show you how to achieve GI regenerative restoration. These have been mentioned before. Let's neglect them and look at the procedures directly. Procedure 1. Orally take the GI capsule. 1. Swallowing. Directly swallow the gastrointestinal regenerative substance capsules with water. 2. Chewing. The GI is chewed specifically for the esophagus and the stomach. In this way, the content can directly play roles in esophageal cancer and remove it. 3. Combination of swallowing and chewing. Half of the GICs are chewed before meal, and another half are swallowed after the meal. These 3 methods should be used based on different situations. Procedure 2 is the actual situation of the swallowed GICs in stomach. After swallowing, the GIC is ground by the stomach. This is the reason why we sometimes feel uncomfortable after eating. Thus, by seeing the actual situation of the swallowed GICs in the stomach, you can see that when we are eating foods, we should eat slowly and chew foods thoroughly to avoid GI damage. If you swallow GICs, when your stomach is empty, it will directly pass into your duodenum without protecting your stomach. Procedure 3, when you have GI disorders and your stomach is empty, remember to chew the GIC. You can see the reason for the internal video of the GIC. After the chewing GIC reaches stomach, the GIC content is a liquid state can adhere to the gastric mucosa immediately. The yellow liquid you see is the content of GIC, which can instantly adhere to the surface of mucosa. This is the picture of patient with stomach spasm, and spasm is relieved immediately after GIC ingestion. Next is the duodenum. The GIC shell is floating in the middle of the cavity, while the yellow content had adhered to the surface of the stomach. The yellow liquid contains micro-wax crystals. Beeswax, 19 micrometers, similar to the size of normal cells. The crystal can adhere to the villi and remove food remnants. The absorption area of people who like eating oil-rich foods is decreased due to food remnants, but after taking GIC, the absorption area can be increased since food remnants can be removed by micro-wax crystals. The efficiency of GIC in these people is instant and obvious. This is not GI regeneration yet, since regeneration takes at least 15 days. The first few days after taking GICs is not the time of GI regeneration, but only the time for removing food remnants and enhancing the vitality of the brush border of mucosa epithelial cells to increase absorption area and capacity, so the cells continuously receive stimulus in order to be activated, which is the first effect after taking the GIC. And this effect is not because of regeneration. The next picture is of the jejunum. Regenerative nutrients are digested and absorbed to adhere to the surface of the jejunum, to cultivate mucosal tissue. And then there is the ileum. So if you take 5 GICs, the effect can be seen in the ileum, since the paralysis of the ileum is slow. Large intestines function to regulate the effects of the absorbed food on the lymph system. Environmental changes and digestive absorption are not the same concept. Procedure 4. Next, I'll explain how to orally take gastrointestinal regenerative substances and how to have our daily meals. The long-standing tradition of Chinese people is good nutrition for breakfast, a large portion for lunch, and a small portion for dinner. But what I'm going to say here is different from this. What I will propose is based on the biological clock of human body, that is, the purpose of eating are different. A. Diet composition. Firstly, the diet composition has changed. What we should eat depends on what is needed for our cell composition and living. Human beings are composed of cells, and cells are made up by membranes. The membranes consist of 60% protein and 40% fat and sugar, while our daily food intake consists of 10% wheat protein and 90% sugar and fat, which is not reasonable. We do eat meat, but most of us eat pork, which consists of half protein and half fat. So the diet composition we proposed is a 4-1-1-1-3 system. My club members have followed this for 5 years, and as for myself, I stew these kinds of foods together every day. I buy many kinds of raw foods and cook them together. I've had this kind of food for many years. I experienced this by myself. As for what 4-1-1-1-3, you can find more about it from the book which we have given you. So what on earth is a rational diet? Answers will differ. We are not in opposition to the long-standing diet tradition. However, if you want to achieve GI regeneration, you'd better follow 4-1-1-1-3 diet composition. B. Diet biological clock. The food we eat can only maintain the nutrients in our body for 6 to 8 hours. So we need to eat 3 meals a day. After 6 to 8 hours, nutrients are metabolized. And if too many nutrients cannot be metabolized, diseases such as gout will result. Biological clock diet is designed based on the nutrients demanded by cell activities. That is, we consume less food both for breakfast and lunch, but more for dinner. There are 60 trillion cells in our human body, and 80% of them act under the control of the brain. When we are sleeping during the night, our brain is also taking a rest, so the 80% of cells act freely, and they are self-renewing and repairing at night. That is the reason why we should ingest enough nutrients for dinner. Thus, we are sleeping. Those 80% can get enough nutrients to repair themselves. Besides, when those 80% of cells work under the control of the brain, the GI is taking a rest. Our study results have also shown that nutrient absorption was faster and better at night compared with nutrient absorption during the daytime. Moreover, nutrients absorbed during daytime cannot be fully metabolized. Thus, we must reduce food intake during the daytime. When those 80% of cells are actively working, the GI is taking a rest. It is at night when the GI is working. Therefore, if we eat too much food during the daytime, it would put great pressure on the GI system. Once the GI begins to work, it will consume 70% of energy, and consequently only 30% of energy is left for work, which is the reason why we feel sleepy at noon and need a nap. After an afternoon nap, your GI is emptied, and you are energized again. Taking an afternoon break is not a good habit and will only shorten your lifespan. Just imagine if you work at 24-hour intervals normally, but now if you work twice in 24 hours, that means you live 2 days while the other people live 1 day. This is the reason. C. Diet principles for overweight or thin people. You'd better eat all 3 meals. Only when doing this will brain control on the fat metabolism can be initiated. The fat metabolism and regulation is all controlled by the brain. Without the control of the brain, fat cannot metabolize. Aside from a well-functioning brain, a well-balanced diet as well as regular diet, biological clock can keep you in good shape. Among our club members, some of them were overweight or too thin before joining my club, but now they have gradually reached a normal weight. This topic will specifically address in my future lectures. If you want to regenerate and restore your GI system, our concluded principle is that you must take the GIC regularly, 5 before meals, 5 after meals, and 5 before you go to bed. Besides, you should also follow your basic diet based on the principles A, B, C mentioned above. People at different ages all need rejuvenation, but the rejuvenation of any organ is based on the regeneration of the GI system. After that, I will give you the specific plan for rejuvenation. Last but not least, let's say a few words on the contributions of this technology to human beings. The most prominent one is can eliminate GI intractable diseases, remove food remnants, enhance nutrient absorption, further improve the quality of life, and prevent premature aging of other organs resulting from the GI disorders. Currently, $270 billion are being spent annually on the treatment of gastrointestinal diseases, which generally are chronic. They are different from an acute disease which can be cured in a short time with less money, but intractable GI diseases cannot be cured by modern medicine. So patients with these diseases have to take drugs every day and spend a lot of money every year. Thus, we can say the economy of expense on the treatment of intractable GI diseases is one of the biggest economies in the world. Thus, if we introduce the rejuvenation concept to the whole world, provide 1/10 of the total middle-aged and elderly people in developed countries require rejuvenation of gastrointestinal organs, which costs 10,000 USD for each person. The contribution to the total GDP would be over 6 trillion. So the GI rejuvenation can greatly influence the world economy. The economy regarded gastrointestinal rejuvenation will play key roles in the world economy, since every human being has the demand for rejuvenation. If people over 35 years old all required rejuvenation of gastrointestinal organs, how many times of the current world economy is the economy regarded gastrointestinal rejuvenation? In that case, everyone will not buy the iPhone and instead save money for GICs. To rejuvenate GI. Well, that is all for today. Thank you very much.